Module 4, Newborn Nutrition. The fetus is going to receive nutrition through the passive manner, through the umbilical cord in utero, but this changes to an active manner at birth. The newborn has unique needs. They need 80 to 100 mLs per kilogram per day and 110 to 120 kilocalories per kilogram per day for growth and development. It's usually sufficiently provided in breast milk or iron fortified formulas. Infants that are less than 6 months are at risk for hyponatremia if we give them water, so we don't want to do that. It's important for mom to select a feeding method. Breast milk and infant formula are balanced to meet fluid and carbohydrate, protein, and fat needs of a newborn. Women should never be made to feel guilty over the method of newborn nutrition, no matter what our personal recommendations or personal beliefs are. Several factors will influence their ability or their decision to breastfeed, and that includes their culture, their age, their education, socioeconomic status, past experiences of this woman or her support system, and her intent to return to work. So cultural influences on the choices of a feeding method for a newborn include whether breastfeeding is acceptable in public. Breastfeeding is the recommended method due to its nutritionally superior content compared to commercial formulas. Now, that's not to say that commercially prepared formulas are not sufficient to allow for infant growth and development, but species specific, we produce what our babies actually need. And it is strongly recommended by various organizations, including the American Academy of Pediatrics, who recommend that exclusive breastfeeding is done until 6 months, continuation until at least 12 months, or however long the woman decides to breastfeed. The goal of Healthy People 2030 is to increase the proportion of women who breastfeed their babies. There are several advantages to mom. There's a more rapid uterine involution. There's less bleeding in the postpartum period. She may lose weight faster. And there's a lower risk for coronary artery disease, breast and ovarian cancers, along with hypertension. There's also numerous newborn advantages. Breast milk contains substances that are necessary for their growth and development. It provides immunologic properties that protect the newborn and strengthen their immune systems. These babies tend to have a lower incidence of otitis media, diarrhea, and lower respiratory tract infections. It is also a possible protective agent against SIDS, insulin-dependent diabetes, and allergic diseases. Studies have also shown that high-needs infants who are breastfed tend to have higher intelligence scores. That comes from a breastfeeding educator information. Family and society advantages. It's economical. It's always available. You don't have to do anything special to prepare it or store it, and you don't have to clean up anything in particular regarding utensils or dishes. And if you're not home, you don't have to carry extra equipment or supplies. There are easy-to-use breast pumps that will allow a woman to express milk, so a family member can feed the baby. Or if she wants to go on a date night, baby can still get breast milk, or if she goes back to work or to school, she can continue to breastfeed her baby. It does reduce healthcare costs because there are fewer illnesses in breastfed versus formula-fed infants. There are no physiologic disadvantages for mom or newborn with breast milk, but there are some perceived cultural barriers that may exist. There are some contraindications on mom's side to breastfeeding, and this includes illegal drug use, active untreated tuberculosis, active HIV, chemotherapy treatment, or herpetic lesions on the breast. Contraindications for the newborn include galactosemia, phenylketonuria, or the baby's just is too premature to be able to suckle, or the mother is unable to produce sufficient breast milk amounts. However, if mom is still wanting to breastfeed, we do encourage pumping, and this establishes her supply, and that breast milk can be fed to the premature newborn. Some untrue or misconceived or perceived barriers to breastfeeding is that it excludes other family members from feeding. The woman may feel unable to return to work or school. Mother may feel it's too difficult or uncomfortable to breastfeed. Some women are uncomfortable touching their breasts or having the infant suckle at the breast. They may perceive that breastfeeding is sexual in nature and it detracts from sexuality. Or they may feel that it ties them to the baby or think that the baby is just going to be too clingy. True or false? Breast milk contains substances that interfere with critical periods of growth and development, particularly in the brain, immune system, and GI tract. This is false. Now, babies have special facial anatomy that helps them breastfeed. It facilitates breastfeeding. Their mouth is uniquely shaped and their nose is uniquely shaped to allow for breathing while the mouth is full of milk. The rooting reflex is a feeding cue, and it coordinates sucking, swallowing, and breathing that ultimately prevent choking. And there is a specific pattern of sucking to the flow of milk. The woman's breast is a very unique organ that's designed to provide nourishment through lactation. It's very vascular, it has rich lymphatic and nervous supply. There's 15 to 20 lobes with alveoli that empty into ducts that lead to nipples. And physical, hormonal, and sensory stimuli all help with that milk production and letdown reflex. When breast milk is released, more milk is going to be produced, whether it's removed by sucking by the infant or the breast pump or manual removal. The body is going to replace whatever is removed. The woman should allow sufficient time to drain the breast, especially if she's using a breast pump. And this is usually going to be 10 to 15 minutes per breast, sometimes up to 20. She has to allow the infant to nurse long enough and often enough to ensure that adequate supply. The woman's body is going to respond to different sensory information from the newborn. Even just holding the newborn and touching the newborn's skin can help stimulate milk production, along with visual stimulation, auditory stimulation, and the baby's scent. The brain is going to process all of these and send messages to the breast for that letdown reflex and milk production. I've talked a little bit already about colostrum, which is that substance that's produced the first 3 to 5 days after birth and might even be present during pregnancy. It's really thick, it's yellowish gold, And it's higher in antibodies, lower in fat, higher in protein than the usual breast milk, also referred to as liquid gold. Fore milk is going to be that milk that is first released at a breastfeeding session. It's going to be watery and thin and may even have a bluish tint that satisfies the newborn's thirst. The hind milk is what replaces the fore milk. So if the infant stays on the breast long enough, the hind milk will be released. It has a higher caloric content, and it's going to actually satisfy the infant between feedings and satisfy their hunger. Some newborns don't want to stay on the breast long enough to get this hind milk, so we always encourage mom to massage the breasts, which can actually cause the release of the hind milk to occur quicker than just the baby suckling at the breast. True or false? The newborn sucking on the breast stimulates the release of oxytocin, which helps with synthesis and the release of breast milk from the alveoli. This is false. So how do we take care of women who decide to breastfeed? Well, first of all, she needs to know nutritional needs. They need to consume about 300 to 500 kilocalories per day above the pre-pregnancy need, depending on her age, her pre-pregnant health status, and her activity level. Now, as a breastfeeding educator, we just always recommend that mom avoid those junk foods and empty calories, but they eat when they're hungry and they drink when they're thirsty, as long as they're getting at least 8 glasses of water a day, because lactating women need a lot of fluids. A daily multivitamin is not going to make breast milk more nutritious. It's basically the breast milk is going to pull the nutrients from mom, so mom is going to be deficient, so that's what the multivitamins are going to take care of. If mom is not getting enough fluids or her diet is not balanced, it does affect the amount and quality of breast milk. So we determine mom's readiness to breastfeed by observing the condition of the breast, inquiring about past history of the breast, her attitudes towards breastfeeding, and her attitudes and amount of support that she has for breastfeeding, and consider that she may require the services of a lactation consultant. We need to assist with and observe the breastfeeding technique, beginning with the first breastfeeding session. That first session needs to be in the delivery room, preferably within 30 to 60 minutes after delivery. And after that should be on demand at least every hour and a half to every 3 hours. Make sure that you take steps to wake the newborn up to encourage breastfeeding. That can include changing the diaper, just waking them up and talking to them, holding them in an upright position, etc. Follow facility policies for appropriate identification of the newborn, and provide privacy and guidance and support as mom needs it. Encourage breast massage prior to breastfeeding, which stimulates the letdown of that hind milk faster, and it also helps prevent stasis of milk. And we always encourage mom to start on the breast the previous feeding ended on, so we know that each breast will be completely emptied every other feeding. You can do this by tying a piece of yarn or attaching a safety pin to the bra on the side where mom finished on, so they know which side to start on. We also monitor the breastfeeding session. Are they effectively latched on? Are they sucking appropriately? Do we see swallowing movements? Does mom have an increase in the flow of lochia and uterine cramping? If she's got that uterine cramping, especially the first few days, we know that baby's got a good suck going on. And we may also see some leaking from the opposite breast. When the breastfeeding session is over, and each one should last at least 10 to 20 minutes per breast, instead of pulling the baby off of the breast, we use the finger to break that suction. Then encourage mom to leave the bra undone to allow the nipple to air dry. We burp the infant between breasts. So how do we monitor the newborn's fluid intake? We don't have a bottle where we can actually see how many mLs they took in. Well, we look in their mouth after they eat, and hopefully we're seeing a small amount of milk in between breaths or after feeding. The baby is satisfied between feedings. They're drowsy or asleep after feedings. By the end of the third day, we're going to start seeing about 6 wet diapers and 3 bowel movements a day. But again, we look at the characteristics of the urine and the characteristics of the stool to really determine, are they getting enough fluids? Some babies only pee 2 or 3 times a day, but they pee large amounts. Other babies pee constantly, but it's very small amounts at a time. Babies with their bowel movements, are they dry and hard, or are they soft? Are they formed? Are they looser in texture, etc.? And we also monitor the baby's weight while they're in the hospital. We do expect them to lose no more than 10% of their birth weight, and we expect them to begin to regain their birth weight and be back to their birth weight by 7 to 14 days of age. Now, mom may have some issues with breastfeeding, and that includes sore nipples, and this will happen literally with every mother. We encourage them to rub breast milk into the nipple and allow it to air dry. There are some special lanolin ointments out there that will help prevent cracking of the nipple and assure proper latch. If mom has engorgement, to help to prevent engorgement, we do encourage frequent feeding, so at least every couple of hours during those first few days of life. Cold packs, ibuprofen or acetaminophen, and do not pump the breast, because whatever you take out with the breast pump, your body is going to replace. For plugged milk ducts, breast massage. Avoid those constricting clothing. Warm packs and gravity may also feel good. With mastitis, breast massage, antibiotics, analgesics, rest, fluids, and don't stop breastfeeding. Special concerns with breastfeeding. Babies go through growth spurts and developmental stages. And at those times, the baby may cause cluster feedings where they're nursing longer or more frequently for a period of time. Mom needs to know that this is normal. Make sure she has available resources for breastfeeding. And breastfed newborns don't require supplementation until they're older. And reminding mom about breastfeeding amenorrhea. Just because she's breastfeeding, we know that she may not have a menstrual cycle for up to 18 months. She still needs to use contraception during this time. We need to educate her on pumping and storing breast milk and returning to school or work. So signs that the breastfed newborn is not feeding well. They have to be roused to nurse. So formula feeding is considered artificial nutrition. Infant formula or another type of animal milk, we don't use cow's milk to feed our babies, but sometimes goat's milk, for example, might be used. There are several commercially prepared infant formulas and several brands that are available. And there's alternative formulas that are available to meet specific infant needs. Say we have an infant that has an intolerance to lactose, etc. Advantages to formula feeding include adopted babies, times when breastfeeding might be dangerous to the infant, breast milk dries up sooner than expected, and it does allow others to be more involved in the infant's care. Disadvantages: it is inferior nutrition when compared with breastfeeding, and it does lack those immunologic properties that breastfeeding has. It is harder for the infant to digest. There is a higher correlation of some diseases such as otitis media and allergies. And formula is expensive. There are more steps involved to feeding the infant, including storing, mixing, and cleaning of equipment. There are 3 different types of formula out there. We have a milk-based, a soy-based, and a hypoallergenic formula. The main carbohydrate source is going to be lactose, corn syrup solids. Protein is a whey casein base or blend. The iron composition can either be high or low. And alternative formulas for special needs infants should be ordered by the healthcare provider. Mom should not decide this on her own. Different compositions, once again, are available based on the needs of infants. If you look at Table 15.3 in your textbook, then you'll see some of these different compositions. Assisting with formula feeding technique, it does come in a ready-to-feed, aka liquid form, or a powder form that you have to mix with water. Always check the healthcare provider's order and confirm that it is the correct formula. Confirm the identification on the IV bands and ensure proper positioning of the newborn. Instruct the parents on how to observe the newborn for proper responses and what to do if they start choking. Always gently shake the bottle before starting to make sure it's mixed well. And always burp after feeding or in the midst of feeding. How do we monitor the formula feeding woman and the newborn? Well, how well is the newborn feeding? How much are they taking? How are they tolerating it? And what is mom's comfort level? And of course, as with the breastfed baby, we look at the baby's bowel movements and their urine output and report any signs of difficulty. Informing about formula feeding special concerns. They need to know how to prepare the formula appropriately. It has to be prepared exactly as the directions indicate to prevent injury or malnutrition to the newborn. Only prepare enough for 24 hours and make sure you refrigerate it because it will go bad. Instruct mom on how to properly warm the formula before giving it. Usually in running warm water, we'll warm it quite quickly. We don't want to put it in the microwave because then that formula tends to have hot spots. Properly dispose of any remaining formula and properly clean all equipment. And never change the type of formula without the healthcare provider's instruction. This can cause some issues with the baby. Only add supplements as directed by the healthcare provider. Now, mom, even if she decides to formula feed, she's still going to produce milk. That's a normal physiological response to giving birth. So mom needs to know how to take care of her breasts, and if she has engorgement, she needs to know how to deal with that. Problems with the formula-fed infant? Maybe they don't want to eat. Maybe they don't tolerate the formula. They have emesis or diarrhea, which can quickly lead to dehydration. And if we prop a bottle for a baby to eat, they can develop what we call the baby bottle syndrome or bottle mouth caries. So how do preterm infant formulas differ from uh, term infant formulas? They have a higher caloric value. And now the post-test.